When you strike the floor to jump and feel a sharp, localized stab of pain at the bottom edge of your kneecap, you are feeling the specific signature of a tendon under extreme stress. This historical image of an athlete at the apex of a high jump captures the exact moment of explosive vertical force that triggers the condition. It is a common injury for anyone in sports built on high-velocity energy storage, from basketball to track and field. While it is often confused with general anterior knee pain, a vague ache typically felt under the kneecap, this condition is a distinct pathology, patellar tendinopathy. It is rarely caused by a single traumatic snap. Jumper's knee is the result of accumulated microscopic damage that occurs when the tendon fails to adapt to the constant strain of explosive movement. Because the tendon fibers are physically degrading, pushing through the pain only accelerates the structural breakdown. Left unaddressed, this leads to long-term joint failure. The mechanical complexity of the joint is evident in this 19th century medical illustration. The knee relies on an intricate web of connective tissue to maintain stability under load. At the center is the patellar tendon, a short, thick bridge anchoring the massive quadriceps to your shin bone. This positioning allows it to function as a powerful biological spring, absorbing kinetic energy and releasing it to launch your body upward. However, tendons have a much more limited blood supply than the muscles they support. When microscopic tears form in the fiber, the lack of nutrient-rich blood flow prevents the tissue from healing on its own. This leads to a dangerous misconception that complete rest is the cure. In reality, total inactivity causes the tendon to weaken further, stripping it of the capacity to handle the stresses of your sport. Recovery begins with phase 1, typically lasting the first 2 weeks. The objective is to manage the load and desensitize the nervous system while preserving as much muscle mass as possible. The primary tool here is the isometric exercise. This involves tensing the muscle heavily against a resistance without actually moving the knee joint. This image illustrates the standard phase 1 exercise, the wall squat. By leaning against the wall with the knees bent between 60 and 90 degrees, you place the tendon under significant, steady tension. The protocol is precise. Hold the tension for 45 seconds, repeat the rep 5 times, and take a full 2-minute rest between efforts. These static holds trigger a chemical response that reduces pain and inflammation. This creates a window of relief that allows you to begin the actual work of structural repair. Once the baseline pain is under control, you transition to phase 2. This middle stage of recovery focuses on physically repairing microtears and reorganizing the thickened, damaged tissue. This is achieved through eccentric exercises, which emphasize the slow, controlled lowering phase of a movement to force the tendon to adapt. As this animation shows, heavy, slow tension forces the disorganized collagen fibers within a damaged tendon to realign. Over time, these fibers thicken and pull into neat parallel rows. To target the tendon specifically, you use a 25-degree decline board. The program calls for 3 sets of 15 repetitions, with a strict 3-second count on every descent. You may feel mild pain during these squats, which is actually a necessary part of the process. That manageable discomfort is what signals the body to begin remodeling the damaged tissue. By progressively increasing the load on the tendon, you build the physical capacity it needs to survive the high-impact landings of a full-speed game. Phase 3 requires looking beyond the knee itself. Pain in the joint is usually a symptom of a mechanical failure somewhere else in the lower body's movement system. This is known as a kinetic chain breakdown. Stiff ankles, weak gluteal muscles, or tight quadriceps force the small patellar tendon to absorb shock that should have been managed by the larger muscle groups. As seen in this standing stretch, lengthening the quadriceps is vital for reducing the upward pulling force on the kneecap. Strengthening the entire chain ensures that forces are distributed evenly across the leg. Healing follows a strict biological timeline. While mild cases may resolve in 8 weeks, chronic conditions often require a full year of consistent, progressive care to fully recover. To fix Jumper's knee, move past the myth of total rest. Manage the load, use isometrics to quiet the pain, rebuild the structural fibers with eccentrics, and fix the entire kinetic chain to permanently reclaim your spring.